Hello and welcome to Woodenslet, a channel for intelligent and curious people like you who are searching for human sexuality in the age of artificial intelligence. Today we are going to talk about sexual health problems in older men. And in the next video, I'll talk about the sexual health problems in older women. Now, although it is highly possible that after 70s or 80s, men and women both can enjoy their sexual activities, and we have already discussed those topics in my previous videos. But exactly, I didn't talk about sexual health problems in older men, especially. Look, it is rather common for men to experience sexual problems after they cross 40. Yes, remember the age 40. So, reasons include a natural decline in testosterone levels. We have talked about testosterone level decline in the last videos because we talked about male menopause, isn't it? It was kind of like a myth which we have debunked. Now, not only the testosterone levels, but there are other diseases too, like heart disease and prostate problems, and many more other things that can directly affect your sexual activity. So it is always better to talk to your doctor or take help from your healthcare provider. The inability to achieve or sustain an erection or reach orgasm or ejaculation are the most common concerns. Okay, so we will start with erectile dysfunction or ED, that is formerly known as impotence also, but impotence is something else, and I will talk about it in a separate video altogether. It is the inability to achieve or maintain an erection firm enough for sexual penetration and long enough to achieve orgasm. While it is more common to older men, aging itself does not cause the problem. It is related to conditions. Always remember that erectile dysfunction is related to some specific conditions. Sometimes several conditions at once. So therefore, the healthcare provider is the best person who will advise you about how to tackle it, how to what kind of medicines you need to use, etc. That, but that directly or indirectly interfere with your erections. Now, there are risk factors always, like blood pressures, diabetic nerve damage, and smoking or obesity, and other diseases also. Depression is also one of them, psychological problems, and even certain medications also directly interfere in these cases. An accurate diagnosis is important, and therefore you need to talk to your healthcare provider. Okay. Now, erectile dysfunction drugs, there are a lot of drugs, but I will not talk about them at all. But I will, of course, I will talk about some kind of myths, like is there any kind of female Viagra, or is there any other kind of things that could enhance some our sexual activities when we grow old. On top of this, there are some enlarged prostate problems. Okay, that can cause sexual problems like low libido. Okay, so, or low sex drive and delayed ejaculation. Okay, difficulty reaching orgasm. Therefore, among the treatment options, there are a lot of kind of treatments options are there. But before going to that options, or you can of course read about it, like testosterone therapy is there, and also other therapies are there. But you need to talk to, again I repeat, you need to talk to your doctor and take their advices. They are the best persons who can advise you regarding this low sex drive or low decline in testosterone. Anyway, but be optimistic, be hopeful, and always remember that these types of problems can be solved. Okay, so don't lose your hope and enjoy your sexual activity even after it is. Thanks for watching. Thanks for your time. Keep supporting Wood and Set. Take care and stay safe.